Welcome to the knee joint questions and responses. Question 1. For we do not consent. Can a painful 80-year-old knees regenerate? If they bend, they can regenerate. When you look at this, and here's the facts. All the structures in the body are continually regenerating. And so if you've had a past trauma, or you have altered foot mechanics or altered calf mechanics, that's going to create an unstable pelvis. So every joint is only around 7 to 8 years old. The problem is, as we age, we produce less stomach acid, and then we're not going to be able to get the amino acids from those proteins to build the healthy structures. So low stomach acid is huge. Now, you can a huge contributing factor of poor regeneration as we age. So we can change that by pre-digesting the food. So we're talking fermented foods, bone broth, collagen. All of these things are broken down and easier to get the amino acids from. So once you solve the nutrition, then look at sleep pattern change. Look at our sleep restriction video, because that's when the body regenerates. Look to stabilize the pelvis, but you got to look at the entire structure. So as long as your chiropractor is looking at your cervical spine, your thoracic spine, your lumbar, your pelvis, the biomechanics of the foot, you fix everything then, and those knees bend, then absolutely they can regenerate, and they regenerate quickly. Do not do the exercises unless you are sleeping good, you've had your pelvis checked, you've had the biomechanics checked for the foot, the calf functioning, all of that stuff, because when you start walking again, it's going to be a little off. Now, we just did a knee rehab video. I'm going to give you another suggestion on that. So once you're addressing the entire body, beautiful. When you're swinging, and you're going to see there's an exercise, putting a weight on an ankle, and the chiropractor is going to tell you whether it should be a 5, 10, 15, 20-pound weight based on your body's strength, the size, and the structures involved. But what I want you to do, I want you to, with the weights, you're just going to be dangling your legs. You may find out that it's hard to swing them even. What I want you to do is just tap something, okay, very, very lightly, and you're going to be tap, 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 and this is going to send more sensory input into the brain and can help with balance issues and everything else. So this is the knee regeneration, and knee rehab can help with balance. It can help with a lot because you're changing that sensory input to the brain. Question 2 from Sandra Scott, 4949. So, Doc, what about me, who fell on the concrete on my knee? Because the medical doctors didn't help me. All they wanted to do is take painkillers. Yeah, I'm with you. And the painkillers, they're typically non-steroidal anti-inflammatories, which actually decrease the proteoglycan production, which is the building block of cartilage, the structure that is in the joints. I mean, it's a crazy procedure. Falling on concrete. Okay, I shattered my kneecap once. I was on a ladder on the top of a second floor, and I ran up with a nail gun and a couple of pieces of wood. I was doing some trim on top of the building there, and I didn't check the ladder. The ladder kicked out from underneath. Bam! Down. I dented the 3-inch water main to the building, and it was really something. And but my knee, bam! I rode the ladder down, bam! Right on the concrete, shattering my kneecap in about 6 pieces. Now, that also, with enough force to shatter the kneecap, that also damaged the knee joint. So when you say falling on concrete on the knee, I got some experience with that. Now, how you rehab it is understand, with that trauma, you have to look at the entire biomechanics, because if that trauma was a week ago or a year ago or 5 years ago, your gait may be off. So the pelvis is off. So even though you have the knee injury, you have to look at the adaptive physiologic response that your body's going to have to shift your body weight away from that damaged side. Now, if the knee bends and you're alive, it can regenerate, but you've got to look at the entire structure. Take, for example, that if you did fall in the concrete on the knee, maybe you fell in the past and shifted your thoracic area. that can put an abnormal force loading on the lumbar. Those nerves in the lumbar supply the knee. They supply the quadricep. So you're talking patellar tracking. They supply the calf and the foot, those biomechanics. So you got to look at the entire structure to see if it's a contributing factor. And then your body absolutely can regenerate. If that knee moves, you can regenerate it. Question 3 from Jeffrey Knerk, PN5N. So, fix the problem and inflammation goes away. Ignore the problem and you get chronic inflammation. Chronic inflammation is chronic stress. That's bad, right? No, that's wrong. Okay, Jeffrey, I mean, this is the common view of the majority of the medical world because they're taught something in school, but then they're trained by other representatives that are trying to sell a chemical product. That's as far as I can go on this one. Okay, inflammation is a healing process. However, inflammation creates free radicals, and the free radicals can damage healthy tissue. So what's the difference between a non-steroidal anti-inflammatory, Advil, Motrin, Aleve, or an orange? Vitamin C. Vitamin C is also considered an anti-inflammatory. Omega-3s are considered an anti-inflammatory. Okay, so what's the difference if they're both considered anti-inflammatories? Well, the chemical ones, the non-steroidal anti-inflammatories, they deactivate that process of healing, which is inflammation. In order to get inflammation, you got to have tissue damage. So once you have that tissue damage, your body can regenerate. The cool thing with vitamin C and omega-3s, and this is neat, it deactivates the free radicals, so it allows inflammation to work better. So it can work better. Now, a lot of times when we get somebody with a chronic traumatic knee, with chronic shoulder, or anything else, we're literally tell them once you restore the nerve supply to that area, and you stabilize the pelvis or any other altered biomechanics, we tell them to put heat on a chronic injury. What does heat do? You're increasing inflammation, but you're also increasing these cells called macrophages that get in there that chew up the abnormally placed blood proteins. That would be chewing up a bruise. Or since you have those cells, those literally break down abnormal cells. They're amazing. Those macrophage activity, then it increases lymph flow, it increases blood flow, it increases synovial fluid and bursa fluid production. So we increase inflammation in joints to regenerate the tissue. Chronic inflammation is a lot of damage to the tissue. Chronic inflammation means that the underlying physical, chemical, and emotional stressors are not addressed. That means it could be a gut issue. And this is where inflammatory bowel disease, they typically decrease that inflammation without addressing the gut flora or the causative factors. So chronic inflammation is bad, and it's treated even worse, but it really is an alarm telling you that it's a tissue repair problem. Don't look, inflammation isn't a dragon trying to attack you. Inflammation is a healing process. Yeah, doctors don't get that, a lot of them. Question 4 from Happy Chick 123. I love your name. My left knee is hurting badly because I stand on my left side constantly and walk with my knee bent as my other leg is shorter. Is there any advice on what else I can try, apart from the exercises you suggest and other videos, to keep your knees moving by swinging your legs? Okay, if your leg is short, okay, and a lot of times it's misdiagnosed, and I'm telling you, at least 3/4 of the time, people have come to me and said, I have a short leg, okay, and I'll x-ray, and when you're standing, weight-bearing x-ray, you take a picture of those femoral heads, and then you can get an accurate representation, kind of. But now the flattening of the foot or the arch of the foot, that can change the leg length. The hydration of the knee joint or the compression of the knee joint, that can change the leg length. I've seen leg lengths change up to 9 millimeters. It's nearly 1/2 an inch. I mean, it's fantastic. So if you do have something that's over 12 millimeters or over a half an inch, then you might want to start thinking about putting a small lift in there. And I don't mean just a heel lift because we don't want to alter the mechanics. I mean just a little extra pad. But even that is so rare. I mean, incredibly, you're talking, 2 or 3 people out of 100 or 500. And yeah, 2 or 3 people out of 500 is probably an accurate assessment for when I would have to get a custom shoe lift or have something built for that patient to somewhat level it out. And you don't want to level it out the whole way. You only want to go halfway. What I mean by that is if you do the x-ray and you find out, let's say it's an inch, okay, 25 millimeters. I would only recommend about a 12 millimeter, about half of that has a lift. But you also have to make sure that the arch of the foot is there, the knee biomechanics are there. And I would go through corrective care before you provide the shoe lift. Because if you can change that 25 millimeters by 9 or 10 millimeters just by restoring the normal function, then you're not going to need to get a shoe lift. But any advice? Yeah, assess it correctly. Get a standard weight-bearing x-ray and also look at the biomechanics of the foot and the knee for sure. And then you can decide on whether a lift is there. But those, and then look at the pelvis, lumbar. You can even have, and I've seen this before, lateral thoracic deviations, which shift all the weight over to one side, and it will appear that that leg is short. So, yeah, you gotta do some deep detective work. That's one of the videos. I think it was wiped out too by the social media gods. I call it Dr. Detective. Question 5 from All Kinds of Music Chick. I like your name too. How crucial is calcium in aiding the knee towards repair? Years ago, I ate full fat yogurt every day for breakfast. Should I go back to eating yogurt? Can it help? It's not just calcium. I mean, you have so many minerals in those bones. And the thing is also to absorb it. So in order to absorb minerals, now without minerals, you can't utilize vitamins. So you got to look at your physical, chemical, emotional stress. Dark green leafy vegetables are the best for minerals, but they got to grow out of a nutrient-rich soil. This is why if you can find a sea plant-based mineral, that is going to be amazing. But then look at your stress level. If you have high stress, you got low stomach acid. Low stomach acid means you can't get the absorption. So that could be a contributing factor. Go back to eating yogurt if it's healthy. If it's organic, hormone-free, if you can get some raw yogurt, whatever state you're in, that is excellent, helps rebuild the gut bacteria. But to get the minerals, look at a plant-based mineral like sea plants. Make sure they're not from China or Japan, because those could have heavy metal toxicities. And then you're going to get the right minerals in there, because it's not just calcium. You're looking at boron. You're looking at so many different minerals. There's over 125 different minerals that your body needs. And if your question wasn't answered here in this video, visit the drbvip.com.